We appreciate you being here. I'm going to hand it off to Lee to get us started, and we're looking forward to having a great day.
Thanks, Brandon. Okay. Good morning, everyone. It's so wonderful to see you all here today. This is our second Chiro Roundtable, but the first since we've been the MAHA Chiropractic Hub. And so it's a very, very exciting time for us. I just wanted to say, I didn't come to Washington looking to build a chiropractic organization. I came to MAHA because I believe America can become healthy again. Along the way, I discovered something that has become a conviction. If we're serious about restoring the health of this country, chiropractic has to be part of the story. So, my theme for today is that lasting change begins by building something, and lasting health doesn't come by treating disease. It really begins by building health. How do you do this? Well, when we began MAHA Center, we recognized that there needed to be a place within the MAHA movement that was devoted entirely to education, implementation, and outreach. MAHA Action is leading the fight in policy and advocacy. The MAHA Institute is advancing research and ideas. But we envision MAHA Center as the place where those ideas come to life. We want to improve the health and the health of our communities, and that each one of our organizations would educate the public, influence policy, and help Americans understand that health isn't something we find in a pill bottle, it's something that we build. To build a series of health-focused initiatives, what we call hubs, that dig deeply into areas that can transform our country. Not simply talking about better health, but creating leaders, building partnerships, and helping Americans take ownership of their health once again. For me, this work has been a natural extension of my life's journey. Long before the pandemic on our farm, we created a small chiropractic room because we believed healing should be accessible and centered on the body's own ability to recover. What we experienced was remarkable. Adults, kids, and babies too. They responded, they improved. It reinforced something that I had believed for years. Americans are hungry for approaches that strengthen health rather than simply manage disease. It's funny, our family, we've had a medical foundation, which I've convinced my husband to leave. We've really tried everything. We've tried every way. We've gone into politics, we've joined health boards, and what we found is really, we have it here in Washington at MAHA and with all of you. So we think there's an opening right now, and we are planning to walk through that. So as you know, I had time as a farmer, farm educator. I've rebuilt an entire community in Vermont, which I've set up. I've worked with Weston A. Price, Heifer International, Children's Health Defense. I've really worked to try to figure out how do we nourish people, how do we care for the land, and how do we learn about trusting the body's innate ability to heal. Along with our team here at MAHA, we really brainstormed. We thought of envisioning a set of health verticals. We look at food and nutrition, farming, homeopathy, mental health, traditional Chinese medicine, acupuncture, natural medicine, chiropractic, and many others. Each one, we will educate the public, influence policy, and help Americans understand that we can make a difference. So then about a year and a half ago, Tony Lyons came to me and said he wanted me to start a chiropractic hub at MAHA. To me, that made perfect sense because, as I've said, chiropractic fits naturally into our philosophy here. We wanted chiropractic at MAHA as another way to help people heal, to heal, be well, and thrive. It was immediately embraced by our team, as you can see here. There's so many of us. And today, though, that vision is becoming something so much bigger than I ever imagined. We are no longer simply educating people about health. We are helping to shape the future of health policy in America. And so now through the MAHA Chiropractic Hub, we've joined with the chiropractic profession. And the ACA and the ICA are working here with all of you. And I just want to thank all of you for a moment, because we took your direction and we're just putting our spin on it, but you are the ones that are really pushing this out, and we couldn't do it alone. We can only do this together. But we do have offices right across from Congress, right across from HHS, and right next to the train station. So you can all get here quickly, we can do what we need to do, and then you can go back home, or you can stay here. But we have generated in the last week thousands of letters to Congress. And we have done this, again, I just want to reiterate, we've done this at your request. And we are just working it into our philosophy, which we agree with. And so this week, we're here at our second roundtable. Tomorrow we'll be going to Congress, and I hope that, honestly, one of my goals is to teach all Americans to walk over to Congress. It's our Congress, it's our Senate, it's our House. This is our country, and we are the ones that can push through policy. So this is our first advocacy day, but I've called on the Senate many times, and I'm very comfortable, I'm very excited, and I think that's what we need to get citizens of America to do. So we can take this model and we can expound on that, and that's why MAHA is here to stay, because we can do this across all the fields. We are bipartisan, we are here to stay, we have a long lease on this building, but we do need your support. And so I'm very gratified that you are all here, and I hope I wasn't too redundant, but I just wanted to say that it's a big day for us. I have my special friend, the Secretary of Health from West Virginia, Dr. Arvin Singh, who we have brainstormed. I have learned from him. He has some of the best health ideas that I've come across ever in a politician, and I'm honored to know him and call him my friend. We invited him here to say a few words, and I wanted to introduce you. Dr. Arvin Singh.
Thank you, Lee. I don't know if I'm a politician.
Sorry.
Good morning, everyone. It's an honor to be here. As Lee said, I am the Secretary of Health for the state of West Virginia. I'm also accompanied by Dr. Singh, who is a vascular neurologist in the state, and my wife. And then Dr. McDaniel across the table, he is the state health officer for the state of West Virginia. So we have good people, good representation who are helping lead a lot of the MAHA efforts in the state of West Virginia. And it really is an honor to be here today. And thank you for everything you guys do to improve the health and well-being of your patients and your communities. In West Virginia, we've embraced a very simple philosophy. The healthiest healthcare system is one that helps people stay healthy. And it's as basic as that. Our focus is on personal responsibility, accountability, prevention, healthier lifestyles, and addressing the root causes of chronic disease. We have invested through the Rural Health Transformation. We are investing over $1 billion over the next 5 years to expand our healthcare workforce, to expand access to care, leverage AI, leverage technology, leverage innovative solutions to get to that root cause of chronic disease and improve outcomes and hold our vendors who we're investing in accountable with payment-based milestones, as we've talked in our state quite often. We're also very proud to be one of the nation's leading MAHA states. We recently enacted legislation that restores the presidential fitness test in our schools. We mandate that now. We also require and mandate nutrition education as part of every physician in the state of West Virginia's medical education. And we also prohibit certain synthetic food dyes in our kids' meals. And we're enacting broader statewide mandates by 2028 that it can't be in any food or grocery stores across the state. I think these are simple, practical, evidence-based solutions. Other countries are doing that, so we're just trying to follow the proper and right protocols for our citizens to promote healthier habits from childhood to adulthood. We also know no single profession or organization can transform health alone. It takes physicians, it takes chiropractors, it takes nurses, therapists, public health leaders, educators, and communities all working together with that shared commitment of prevention. So thank you for allowing me to be here, and thank you for the important role you guys play in building healthier communities. We all look forward to working together and listening today, so thank you.
Thank you. You know, I really think it's important that as we all learn to work together, we can really push forward best practices. And you're one of the people that is doing that, so thank you.
Thank you.
And now I'm going to turn it over to Brandon Hoffman, our new Executive Director. Brandon?
Thank you, Lee. And thank you, Mr. Secretary. West Virginia is lucky to have you, and it's been an honor getting to know you. I also want to give a shout out to our amazing team here at MAHA who put together this roundtable this morning. It was a big lift. We were working hard. So Kyle, Maddie, Deirdre, Marin, and the rest of the team really, really appreciate all of your support in putting this together and making it happen. Looking around the room for a second, most of you got on planes to Washington, D.C. because you believe this profession's moment is now. The room did not exist a year ago, and although we were trying to make it happen, and I'm thrilled it began with the original meeting this past March, what I see is Make America Healthy Again is a national movement with momentum, and the chiropractic profession is now in it. You're in it, and we're going to make a difference. On June 3rd, the MAHA Chiropractic Hub officially launched. And on July 1st, something happened that people in this profession have waited for a very long time. So what is the Hub? Said plainly, it's a platform that convenes the professions, coordinates shared priorities, and puts MAHA's communication, grassroots efforts, and advocacy infrastructure behind all of the different associations, the different organizations in this room's work. It certainly does not replace the ACA, the ICA, or any of the other organizations in this profession's already doing great work. It amplifies them by design, and the infrastructure is live. The legislative tracker through MAHA Action is on. The education pipeline is being built out, and we're going to have more on that with some speakers later. And the events engine produced the 3 days you're standing in right now. Now, getting back to July 1st, it was a historic day. For the first time in the modern history of the profession, the American Chiropractic Association, the International Chiropractors Association, and the MAHA Chiropractic Hub signed a formal Memorandum of Understanding committed to one shared mission, modernizing Medicare for chiropractic. One profession, one bill, one voice. I want to recognize the leadership it took to get there, and some of it is sitting in this room. Dr. Joe Betz, Dr. Kris Anderson, both associations chose unity. But here's the important distinction. We have not made history yet. We signed the agreement that makes history possible. History is a committee vote. History is a floor vote. And history is a senior walking into the chiropractic office getting the full care they deserve. The bill is the Chiropractic Medicare Coverage Modernization Act, H.R. 539 in the House, S-106 in the Senate. Seniors get access to the care doctors of chiropractic are already licensed to provide by their states. Medicare is the outlier right now, and it has been since 1972. The bill has broad bipartisan support in both chambers, and the co-sponsors alone don't pass the bill. So, our goal is we need some committee action, and that's what we've been strategizing over the last few weeks, and that constituent outreach certainly helps push the needle to try and make some change and really get the bill out of committee, marked up, etc. So I want to be precise about it because every person in this room should be saying the same thing. We support passing the bill and strengthening it with the 3 amendments as it advances. First, coverage tied to each state's authorized chiropractic scope with clear boundaries, non-drug, non-surgical, and it stays that way. And, I think all of us in this room understand that, hey, we're not trying to dive in deeper into medicine. We're trying to deliver chiropractic care. And we're certainly in support of that from this end. Second, we hope that we will have equal Medicare opt-out rights and private contracting rights as part of it to bring it in parity with other physician-level Medicare providers. And third, a reasonable implementation deadline. These 3 amendments make a good bill better, in our opinion, and we're ready to make that happen and get it passed. So just want to set some ground rules for the day so everyone knows how the room is going to run. First, on timing, we built this morning deliberately. The Medicare update first, then every corner of the profession with the floor in turn. The paired presentations, you'll see the first set, we're going to have 2 speakers each for 10 minutes, and then as we go on, there will be 1 speaker, 5 minutes. We have a clock here so that everyone knows we're going to stay on time. And after that, on questions, please hold them. There's going to be a Q&A that will moderate a block before lunch. So where everything from this morning we're going to discuss, it'll be on the table. We can have questions, but please hold them for after the presentations. Nobody's question is going to get lost. We're just going to try and do it in a unified format. And so I want to pass it on now to give an update from both the associations. I'm going to give it to Dr. Kris Anderson first, and then you'll hear from Dr. Joe Betz.
Thanks, Brandon. And just my sincere thanks to the hosts. I was not able to attend the first meeting that we hosted together, but I'm thrilled to be here now, especially in light of the updates that Brandon provided. So my name is Kris Anderson. I'm a chiropractor in Grand Forks, North Dakota, and I'm the current president of the ACA. And I'm thrilled to give you an update about where we are now when it comes to HR 539. I think as we move from where we were to where we are now, I think the ACA's position was previously HR 539 is the most politically viable option to increase patient access to chiropractic services. That doesn't mean it's the only viable political option. And I think what we've moved from is yes, 539, but now we're at yes and. And the way I look at it as a profession, and as we're here together in this room, I think we've all moved to yes and. And some parts of the profession previously would have said no but, and had alternate options available. At this moment, I'm really thrilled to be at our yes and moment, because I know that after mobilizing the profession in one direction, we've seen a big jump in the engagement on our voter voice site. Just since in the last 10 days, we've seen significant increase in the number of emails sent to congressional representatives, senators, advocating for what we know is a really critical thing. People need access to what we do. And the profession has other needs as well. And I think all of us moving together and coming together with the support of MAHA, we're excited to see where that can lead. In the Senate, the primary sponsor on S-106 is my senator from North Dakota, Kevin Kramer. And in January, when we were here and met with him, they asked us, is MAHA in support and is the chiropractic work group in support? And we took that as marching orders. But I have to admit that in my wildest dreams, what I have imagined, I'd be here today with the whole profession, with an MOU, and all of us, and I hope with an attitude of yes and, because I just know how critical this moment is for the profession, and I'm thrilled to be here as leader of the ACA for it. So thank you all for being here, and thank you for your support.
Hello, everybody. I'm Dr. Joe Betz, and I am also a practicing chiropractor in Boise, Idaho. And so the work that Kris and I do is you guys probably know, is all volunteer work. And so we started our relationship talking with one another not even a year ago, not even 12 months ago. I told Kris earlier I felt like I've known him for 10 years now, but because I honestly talk with him as much as I talk with my own kids and wife, maybe. So it's been a developing relationship. And then when MAHA approached the profession about coming to Washington last March, it was just perfect timing. We had already laid a foundation of building trust, the two of us, and having discussions, and that built into building trust between our organizations. And we had the opportunity to meet with the ACA more formally last August, and so we were building these steps and building this foundation that I don't know if we've ever had in the profession before, at least not in my career. And so it was an opportunity to be able to work with MAHA, this big entity that we share so many common goals with, and we share ideals with about American healthcare and how it can be improved. And Medicare became the catalyst for what we needed to work on first. Not necessarily that it's necessarily the most important thing we need to do in America for healthcare, but it certainly is the most time-sensitive thing we need to work on right now. And so we put all of our efforts behind that, and we listened to the profession. We listened to the summit and what was important to them, and we came up with a list of what was important for the profession to work on, and that's what we've been doing. But it's not just, you guys hear about Medicare all the time as to what we're focused on, but all the other things are being worked on as well. The foundation is being laid to work on a lot of different things with MAHA, and that's the most exciting part. I'm hoping to have Medicare done. I was telling Dr. Yeager, I don't know if I could do another year of this, working on the Medicare project, but I definitely would love to see us get this done and finished and moving on to other bigger things. And so I just want to thank all of you for being here. The ACA and the ICA working together is just a small representation of all of us working together at the table. It's not the ACA and ICA show, it's the chiropractic show. And we're just a small picture of what we're all trying to do together. So I just want to thank you all for being here and making the trip out.
Thank you both. Really appreciate the update. And one thing I will add, because I think it's important, is, one aspect that has come together in the last week, we have seen momentum, mobilization. There are probably hundreds of thousands of outreaches that have taken place between the different organizations in the profession, all united behind sharing the message of trying to get this bill passed. So I'm proud to work with both of you. I'm really happy that we were able to come into this meeting on the same page, united, and we're going to look to get it done. So shifting to our next speakers, I want to introduce Dr. Lona Cook and Dr. Amanda Blonigen. They have worked together on a really awesome program in Chippewa Falls, Wisconsin is where it started out, to bring chiropractic care to children within schools. And I think they've seen incredible results. They're scaling this effort in a really meaningful way. I'm proud to get to know both of you, and I can't say enough about the work that you're doing. So I'm really excited to have you both speak today.
Good morning. It's really an honor to be here and share about this project we've been working on. It truly is a grassroots effort, and we're very proud of where it is today, as well as we know that we're just getting started in this and what could be possible. So Dr. Amanda and I practiced in Western Wisconsin. I've been in practice for 16 years. Probably about 13 years ago, I was at a New Beginnings seminar, which some of you have probably been at in New Jersey, and a speaker was sharing from the stage and having everyone go through a visualization of what would our communities look like when the average person understands much of what we understand in the chiropractic paradigm of where true health comes from, the power of a healthy nervous system, and to the point that in the visualization he went through, what would schools operate like? Instead of asking for vaccination records upon entry, what if it was asking about more proactive things like, has your child had a chiropractic checkup before they entered kindergarten? And I remember being in that room thinking, that sounds great. I don't think that's going to happen, right? I was that person that couldn't see it. And at the same time, the speaker did a great job because mission accomplished. He said, if you can't see it, you're part of the problem. The pharmaceutical industry doesn't have a trouble thinking this big for our population and our kids. Why do we? Right? And that really resonated something in me where it agitated something. I went back home. A couple years of practice go by. I started to open the door to our school district to bring care on site for first the staff, right? And I thought maybe 10 years from now we'll get to do things with the students, but it started with the staff. So would bring portable tables. Here's what I envision, or for chiropractors when I talk about this, is like, it's like care is happening at your office, it's just in a different, 4 walls, right? So of course they would come into the office sometimes, but most of the care was happening actually at the school district. After a year of that, one of the administrators came to me and said, why can't we do this with the students? And I was like, well, if you think we can, then I think we can. And so I promptly called our executive director and said, I need to have my I's dotted, T's crossed. This door is opening. How do we do this? And we began. And so we started in the most underserved elementary school that had the most behavioral issues. And she said, honestly, with some of these students, we would try anything to see if it made a difference for them. And so I said, okay, give me your worst kids. And so they sent home 50 intake forms. We got 20 back from their parents. And here's what I want you to know. This is already happening in schools. some of you know this, but like OT, PT, sometimes dentistry, mental health services, all of this is coming into schools. It's very normal for them that care is being provided at school. We just haven't done it yet, right? So for her, it wasn't reinventing the wheel to open up this opportunity. And so we began with the first 20 kids. At the end of that semester, they said, you're coming back next year, right? Sure. Okay, so then we were growing into the next semester. Then the next school came online. Then Dr. Amanda came up and shadowed and said, I don't think I'm supposed to move back to Ohio. I think Wisconsin sounds really nice. So she came up and we were then able to, she went half-time in the schools and then full-time in the schools, and now we have a team of chiropractors designated to school-based care, and we're in multiple districts doing school-based chiropractic care. So it's pretty amazing where we've come. Somewhere along the lines, we met Heidi Havoc and her research team, as well as Life University, and they started helping us actually put, data together of what we were seeing, not just the subjective results, which Amanda's going to talk a little more about. But it's quite simple. I think it's almost too simple sometimes, and that's what's hard for people to understand, is when the doors open and we actually show that this is making a difference with this student. The student maybe is having a better day, or the staff is having a better day. Now they recognize we probably should send intake forms home to these other kids here. And so it's really grown rather quickly as we got our feet under us of oh my gosh, this thing is going to keep expanding. And so our nonprofit, we are fully a nonprofit now. We work a lot with students that fall below the poverty level, but that's not only who we see. We also have a chiropractor that sees the athletes in the school, that type of thing. Our nonprofit is called Well-Adjusted Students. There's a few binders that Amanda's passing around that have our research that's been published in there. And the key thing is, I said the simplicity of it. The kids aren't missing much class, which the teachers appreciate because adjustment doesn't take very long. We're there weekly. Most of these kids would never have access to consistent care otherwise. So it really is an access thing. And you think about what could this mean for the chiropractic profession if this really went into more of our public schools. You have a generation of children that chiropractic is normalized to, and then they become the adults who really are making different healthcare decisions because it is normal to them that you have a healthy spine and nervous system and your life is better for it, right? Pretty simple. So I'm going to let Amanda take over and we'll go from there.
Yeah, so everything that we're seeing in the schools is what all of you see in your practices, but the schools are using the words dysregulation. They know that the school is dysregulated, the kids are dysregulated, and they're looking for any solution out there. So one of the things that's really important in what we're doing is the above, down, inside out. It starts with the staff getting adjusted first. You know, I'm in the schools every day. It is not uncommon to hear kids screaming, kids banging their heads, kids running away. What does this mean for our staff that are learning how to put a kid in a hold without injuring themselves or others? The turnover rate for educators is so high right now. So supporting the staff is so important in this. We also know that the kids, right, they need this. They have so many things stacked up against them, especially in the population that we're seeing. You know, it's not uncommon that we have this boy that when he comes on Monday morning, you know, from mom's house on the weekend, he comes back pretty regulated. But when he comes back the following week from dad's house, he's very dysregulated to the point they can't even get him in the school building. We've seen him crawl into our room to get adjusted and then get up and walk back to class. And when you think about what that does for that child's day, and then you extrapolate that out to his week, you know, we know that we're setting him up for a better, successful year in school, which then turns into the rest of his life. So we have compiled years of work in the schools. Life University and New Zealand Chiropractic, they went back and did a retrospective study in 2025 where they took results for 180 kids that were under chiropractic. They saw reduced hyperactivity and improved quality of life. And then from there, we did a feasibility study where we just want to see what is the cortical function happening in these kiddos that are getting adjusted at school. We have tons of subjective data from the top down of people seeing results, but we need the data to support that. So they came out and did that study. We have a study starting in fall of 2026 that is already funded, that is working on kids with sensory processing disorders and what their heart rate variability does with chiropractic adjustments. And then we also are looking at attendance and ODRs, so that's how many times the kid gets pulled from the classroom and sent down to the principal's office. And one thing that really excites us is we were able to compare that to kids that aren't getting chiropractic and kids that are getting chiropractic, and the results speak for themselves. And even if that is one adjustment or one kid that isn't going to the office as much, like, you know, when we're seeing hundreds and hundreds of kids, that makes a huge difference in the school day. So we are fundraising for our next round of research, which potentially could be the largest blind study in pediatric chiropractic. We serve hundreds and hundreds of kids each week with weekly adjustments. And like Lona mentioned, you know, it's a simple thing to come down to get an adjustment and go back to class. And that is, I think, the biggest thing we have to offer is for some of these kids that would not have access to care. A lot of kids in, you know, foster care and IEPs and kids that are struggling, and if we can give them a leg up with chiropractic, that's what we're here for.
Amazing. And Amanda is like truly every day in the district, so she knows, she's like there foundationally all the time. So she's the woman that sees the ins and outs every day of what it's like for the teachers and the staff, of teachers, staff, and students. At the end of the day, what we see the path forward is we think the school districts are actually more ready for us than we may be for them, and getting chiropractors ready to do this work. They could obviously expand through our nonprofit. It also is something that we could teach individual chiropractors how to set up this relationship with their school districts and then provide the care. You know, it's a different problem when we start to think about that, of like, how could we actually have a chiropractor in most school district buildings, just like a school nurse, right? So that's our project. Thank you for letting us share about it. We're really excited about where it's going to go.
We've heard from a lot of people in the profession about wanting a focus within, you know, pediatric care, and I'm really excited that we get to highlight Dr. Amanda and your team in the MAHA report coming up as our first educational article that will be released from the hub. So be on the lookout for that. It's a wonderful article, and keep up the great work. Next, we have Dr. Vickie Dubin-Master and Dr. Steve Tullius. Dr. Vickie has, been a part of this and at the center of this work before the hub had a name. She has been the MAHA liaison and is a dear friend of Lee's. We've gotten to know each other over the last number of months, and it's been an honor getting to work with you both. And, I want to allow you to share an update from the Chiropractic Working Group and fill us in on how that's been going. Take it away.
Hi, it is such a pleasure to be here today amongst all of the people here in this chiropractic profession. Thank you so much for my working group, our working group, for being here. Can you guys raise your hand who's from the Oh my God, it's so great to see you in person. Some of you I've never met in person, and I'm so proud of all of us and the work we're doing, and also as a profession. And thank you to the MAHA staff for doing all this work to help chiropractic and our country get healthier again. As far as I'm concerned, MAHA is chiropractic's moment to shine. Kennedy took the truth and woke up the public about what's really going on in the medical field. And we are the OG MAHA, the original gangster MAHA. We've been doing it for 130 years. We have the solution, answers to the problems that people are looking for, and we always did. So what was the spark that caused this working group to get started? I was at a MAHA Institute inaugural roundtable event in May of last year, and the roundtables were on infertility, metabolic and chronic disease, mental health, child health, and women's health, to name a few. There were medical doctors, educators, scientists, researchers, nutrition experts, but there were no chiropractors. Chiropractors see patients with these problems on a daily basis, and we help them get well through our care, through chiropractic adjustments. And it was so frustrating to me, and some people are here that were at that meeting as well. And we were all blown away that this was happening because we thought we were MAHA. And I kept seeing more things like that happening, where there were roundtables on different platforms around health and trying to figure out solutions, and there was no chiropractors, or at least they weren't saying anything about chiropractic. I asked what to do. I was told we need a working group and we need white papers if we want to get our voice heard. So luckily, I was already the MAHA liaison, thanks to Lee and everyone, and I had an email list going that I started last year in June. I put the word out on about the working group. I got some responses, but for some reason, I didn't have what it took to get this going. I prayed hard and I was about to give up, and then someone connected me to this guy, Dr. Steve Tullius, and the problem was solved. He was the perfect partner to do this work, and he was all in. He has the skills and the talents and the connections, and we got started right away. So we started our first Zoom meeting with the Chiropractic Working Group in December, and everybody that was there are committed leaders in our profession. They're passionate, they're brilliant, and they're all in with the mission that we wanted to have. So the meeting, that first meeting, we just talked about white papers, about goals and objectives, and we decided we need to meet every week because we need to get things going with this. So what is the mission of our working group? It's to unite chiropractors as leaders in solving Americans' health crisis by restoring nervous system function, salutogenic paradigms, and adaptive capacity across all ages. What does that mean? We advance evidence-informed, non-pharmacologic whole person health, AKA chiropractic, as a primary solution within the MAHA focus areas, which are family health and wellness, metabolic and chronic disease, fertility, preconception, maternal and perinatal health, pediatrics and neurodevelopment, emotional health and mental health, addiction and recovery, veteran health, sports performance and recovery. What is our mission? It's simple and powerful. For every person and family to have a chiropractor they have access to go to, and they understand why, first primarily for healing and maintaining health with a strong emphasis on prevention. 2, we normalize spinal and nervous system checkups across lifespans, starting at birth. Nervous system regulation supported early and consistently is the difference between merely managing symptoms and actually supporting long-term health and vitality. 3, we also want chiropractic's message to be clear and concise. Nervous system enhancement through spinal subluxation-based care. We want it understood and respected in the mainstream conversation, in public messaging, government-funded research, education pathways, professional standards, and community awareness so that health freedom is protected and quality of life is optimized for everyone. That's what the MAHA Chiropractic Working Group is here to do, build consistent education and trusted influence so the public receives clear, powerful information about nervous system function. Trying to do this fast. And so chiropractors show up as leaders with real solutions. If not us, then who? If not now, then when? If not here, then where? And here's Steve.
Thank you very much, Vickie, and thank you all. Thank you, the MAHA team, and just what a monumental week this is for all the leaders to come together like this is truly amazing. So, really, the working group exists for one reason. It's for the belief that we in this room all have as chiropractors, that if every man, woman, and child was checked from birth throughout a lifetime, that we'd have a massively different nation and planet. And that's what we're here to accomplish. The Medicare bill helps move us towards that and creates that first win for our profession. I think that will really unite multiple camps in the profession that really need to come together once and for all. And I'd like to ask this room a question. How many of you, before you left, checked any of your loved ones? Did anyone check any of your loved ones this week? Or were checked yourself for subluxation? That's the gap right now that's happening in America between what we know and believe and what could be so amazingly powerful for this nation and for this world. And right now it sits in an area of belief because we don't have the data. We have to be honest with ourselves. We don't have the data that supports me checking my 14-month-old on a weekly basis. I would never dream of not checking him. That's what every mother deserves to understand. I believe that's our moral obligation and our duty. And it's happening. And it's happening because of MAHA. I believe in MAHA, and I believe in this group. I believe in our executive director. And I'm just so excited. And one of the steps is the white papers. That's what we're working on right now. We have 5 working white papers that we're going to be releasing soon around pediatric health, mental health, chronic disease, the areas that MAHA is so passionate about because that is why America is not healthy. Over 60 to 70% of our nation is chronically ill. That's just wild that's the reality. And so we have such an opportunity right now because MAHA puts our beliefs into action. And what we need is that research piece. Lona, Amanda, what amazing work. I've experienced that in practice. That's where my practice was focused. And the pain that those children and those parents feel is real. And we have a moment to really shift that. And I'm just so grateful for the opportunity to be with you all here this week and to share this mission together. So thank you very much.
Thank you so much for the update. Appreciate everything that the working group is doing. I got to sit in on their meeting last week and phenomenal work being done. And one of the members of the working group unfortunately couldn't be here with us today. Dr. Gilles LaMarche, we're sending him our thoughts and prayers and hoping he gets well soon. And to that end, we have a card that we would like everyone to sign for him to send his way when we wrap up today. But yes, greatly appreciate the working group. It's been a massive support to the MAHA team. We are a little team. We work extremely hard, but there is only a certain amount of bandwidth, and we need people, from this room to support that and appreciate it. Next, I have some dear friends who I got to invite to join us today. I think, John, it's probably been maybe 10 to 15 years now that we've gotten to work together through my father. And, one of the biggest, I'll call it a misconception, they can correct me if I'm wrong, but education pieces out there is related to chiropractors allegedly causing a stroke in a patient. I don't believe that to be true, and they have the evidence to back that up. They are passionate about this issue. John, he's not your standard attorney. He's extremely research focused, one of the smartest people I've ever met in my life. The thing I love about him, when he gets up to defend these chiropractors, when they have an allegation of causing a patient a stroke, he's more passionate a lot of times than the chiropractor is about the issue, that they couldn't have done it. And he wants to go and fight and win and defend them. Kyle, he's just as smart. He's awesome. We've gotten to know him over the years as well. They make an absolutely phenomenal team. So I can't wait to have you speak to the group, and I think it's a really important update.
I'm afraid that your opinion of me may go down after my speech, so maybe I should pass the mic. In any event, I am John Salvucci. Seated to my left is Kyle Allen. We are partners in the Philadelphia office of a national law firm. And it may be difficult to discern, but I am actually older than Kyle. And so yeah, I know, it's amazing. So he's deferred to me to give the opening remarks, and he'll pick up on questions and answers because he thinks faster than I do. So, yes, over the past more than 10 years, Kyle and I have been associated in the defense of over 125 cases in which plaintiffs have alleged that high-velocity, low-amplitude cervical manipulative therapy by chiropractors have caused a dissection in the cerebral arteries, either the vertebral arteries or the carotid arteries. And we're proud to say that in the 27 cases that have gone to verdict, we have 25 defense verdicts. And that record we hope, and that proportion of victories we hope to continue. The reason for this is because the medicine and the science both support the conclusion that this therapy cannot tear the innermost portion of the three-layered cerebral arteries. We have developed silos of defenses based upon various research. For example, biomechanically, we have shown that these dissections can occur. Professor Herzog, with whom we've met on a number of occasions, and his team have spent over 20 years developing the proof that the therapy can't tear the intima. We have met with and discussed and in detailed gone over the epidemiologic evidence with Professor Cassidy. And as you probably know also, the other epidemiologist, Dr. Kozlov, has done a similar study in the U.S. using a U.S.-based population. We have developed through our research over 1,300 articles in our library that support our position, including notably the meta-analysis by Dr. Church. In any event, during the course of these 10 plus years, we've also formulated defenses. We've also, based upon our reading, identified areas of defense that had not previously been recognized. For example, the aging of blood, which is done in many other spheres, we brought to the fore in these defenses. How does that help us? It helps us because when the plaintiff alleges that I came in on Thursday and the chiropractor tore my intima, we, through the imaging, through hard evidence, CT and MR imaging, can show based upon the aging of blood that the dissection occurred a week ago. And the death of a red blood cell can be watched because it loses first oxygen and then hemoglobin. And this death cycle provides a difference in intensity and in contrast on these imaging studies. So this is hard evidence that the dissection was not caused by the therapy. But we go beyond that because we put forth to these juries the common sense argument that certainly trauma can cause a dissection. But what does the literature show us? The literature shows us that blunt trauma, accidents involving motor vehicles going over 60 miles an hour, blunt trauma, yes, it can cause a dissection. And what percentage? Less than 1%. 0.7% of those involved in severe blunt trauma accidents actually have a tear in their artery. Now, let's go further. Of that subset of people, let's take those who have had blunt trauma and now put them, and have had a dissection, put them collectively in a circle. Over 95% of them have a dislocation or fracture of their cervical spine at or about the exact location where the intima has torn. Contrast that to the proof that we can put forth, going back to the imaging studies that I referenced before, the MR and the CT. In those studies, there's never soft tissue damage at or about the tear. There's no evidence whatsoever that a force has come from outside into the area of the neck. This is powerful evidence that juries can appreciate and absorb, and we're happy that we, over time, have been able to put them forth and assist counsel around the country, because our cases are all over the United States. I think currently we're in about 28 states. And as your profession grows, the incidence will increase, because although dissections are rare and strokes from dissections are rarer, when you're doing multiple millions of these manipulations on a daily basis, we're going to have that allegation continue. And it continues for one primary reason. The time from dissection to stroke is 30 days at most, but primarily 7 to 14 days. And Kyle and I, through all of the cases that we've had, the sequence is identical. Someone comes in, I have neck pain and headache, classic signs of a dissection, but also signs of multiple other musculoskeletal problems. They come in, they say, 5 days ago it started. Okay. In every case that we've had, the stroke occurs within that 30-day period and clusters around the 7 to 14-day period, which has been established in the literature as the time from dissection to stroke. So we've never had a maintenance procedure result in a stroke claim. We've never seen it. Every single case has been identical. I'm working with now with Dr. Demetrius, and I'm also working with some others to put forth literature that further acts as a basis for the defense that we have in these cases. But let me end on a down note, okay? We win these cases. However, those cases that get national attention, okay, the big exposure cases, they get settled, and the population and the public recognizes that that has occurred. Now, am I criticizing the doctor or the insurer or any portion of that team? Not at all, because their exposure is well beyond their coverages. There's no criticism by me of that defense team whatsoever. But the brunt of that resolution falls upon us collectively. We suffer as a result. And I'll give you one example. We had a case, I won't even mention where it is geographically, but probably many of you are aware of it. A young woman, stroke following the manipulative therapy, very, very dire outcome. She was in very bad shape. I wanted to bring that case to trial. It was resolved. And the reason I wanted to is because she had multiple dissections, which is a sign of an underlying genetic predisposition or a disease. But over and above that, she had 2 or 3 dissections upon admission by scan, by imaging. Subsequent to her admission, she had 2 additional dissections. Clearly, the process that was taking place had nothing to do with the chiropractor. And that evidence was so forceful that we could demonstrate to a jury that it was a process that she was involved in that was completely unrelated. However, once again, I don't criticize the resolution, but I'm saying I'm aware of a way to approach those cases collectively as one force, which I won't go into now because I only have 15 seconds. But I would love to share with all of you, and perhaps we'll have an opportunity to do that later. Thanks so much.
Well, Kyle, per usual, John took all the time up. If you have any quick remarks, you want to share anything, I would love to have you speak because you've been an awesome team member in this as well.
You have 5 seconds.
Yeah, I'll just take, so we are very effective at convincing courtrooms, 12 jurors at a time, about the truth. But that's not enough. My wife often asks me, what are you doing on my phone at 11:30 at night, scrolling, social media? And I said, I'm fighting with people online, on Reddit, on Instagram, who are saying that chiropractors cause strokes. And I have 2 anecdotes. One, there was, and this is, I think this is a problem. I know this is a problem. So in one case, there was a doctor who was arguing that chiropractic causes vertebral artery dissections leading to stroke. And I responded to one of his posts and I said, have you read all of this research? And he came back about a month later and he said, you know what, I read this research and I think it's convincing. And he said, you've changed my mind. And I thought, wow, that's never happened to me on social media before. Another instance, a woman said, my sister had bilateral dissections. And I said, if you think a chiropractor caused this, I would encourage you to go to a neurologist, go to your PCP, and have them test her for a connective tissue disorder. And she DM'd me 6 months later and said, my sister has a connective tissue disorder. And I said, I'm telling you, chiropractic did not cause this dissection. But at a matter of scale, 12 jurors at a time in courtrooms across the country in 2 or 3 trials a year is not enough. Me convincing people on social media, 1 to 2 people at a time, is not enough. The problem is that we have all of this research, but how many people in this day and age are sitting, listening to someone explain over the course of even 5 minutes? And John, great job. Great job. In 5 minutes, you distilled an extraordinary amount of information. People, this is like Occam's razor. The easiest answer is often the truthful answer. And so when jurors hear a chiropractor put their hands on somebody's neck and something bad happened, for them, it's very easy to make that connection. But that's wrong. Occam's razor, in this case, has been disproved. And so we work very, 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 very hard to get the truth out on a broader spectrum. And I think that this working group, and it's so cool to be invited here, I think this working group, bringing this information and putting it in a broader public light is so important, not only to what we do, defending chiropractors around the country, but also to the future of your profession. And so we're really happy to be a part of this, standing behind you, defending you where you need it, and we certainly encourage all of these efforts. Thank you.
Thank you both so much for being here with us. We've gotten to become great friends over the years, and one funny story just to round it out. Last year at Life University, we got the pleasure of speaking with both of them from the stage, and all of a sudden, out of the blue, I was getting deposed by Kyle, not realizing that that was part of our talk. So, it went well, but I'm certainly thrilled to have them as part of the team for chiropractic. They are passionate and they believe in what you do. They don't believe that you could have caused this to happen and want to make sure that the truth ultimately gets out. So thanks again for being here with us. And, one thing as more of a long-term goal that John, Kyle, and I have talked about over the years, and something I hope to see happen through the MAHA Chiropractic Hub, is really being able to elevate the research around this issue and perhaps solicit new research to continue the effort fighting on behalf of the profession to dispel this myth that chiropractors cause stroke. If you go on Google, you'll see it all over the place, and it's ridiculous. But they are certainly spearheading an effort to make a change on that.
I'm sorry, do you think we can?
She's the executive director of the ICA, and she's going to talk about things like Section 2706, which we've talked about, and she's done a lot of work with us at MAHA. She's been phenomenal in providing support, articles, things of that nature that we're going to continue to expand upon. So we really appreciate that, Beth. And if Bharon has anything to tie in from, the VA, DOD, et cetera, going to let them tag team it a little bit and share some updates for us. Thanks so much.
Thank you, Bharon. So for those of you who don't know me, I'm Beth Clay, and before working with the International Chiropractors Association, I spent 7 years at the National Institutes of Health building an administrative career, and then I got recruited to work for Congress on the Oversight Committee. In 5 years, we did investigations looking at the role of complementary and alternative health care in our U.S. healthcare system, and then we got involved in other things like the anthrax vaccine and vaccine injury and the management of the vaccine injury compensation program. So I have learned and read all of the emails and research and everything from all of that. I like to say I have forgotten more than most people will ever read about vaccine safety. And that is an area that brings this world together in a lot of ways. And after leaving Congress, I began consulting with the nonprofit world because that's where my heart is, and stayed very involved, and that's how I met Robert F. Kennedy Jr., working with the what was then World Mercury Project, and I drafted a report for them on Dr. Paul Thorson, who was indicted, in 2011, and he's now in jail in the United States to stand trial for stealing money from the autism grants, and I hope that justice is served there. But why I bring that up, because MAHA coming together with the chiropractic community is kind of like a lifetime of work in preparation for where we are right now for chiropractors who have been discriminated against in the federal laws, and so we have a chance to right those wrongs. And I am happy to be here to talk about a little bit about that. The first thing I want to go over is Section 2706. So back in President Obama's first administration, we were focused on the Affordable Care Act and bringing together everything under the sun that wanted to be done in health care. One of the things that happened is that Senator Tom Harkin, who was our champion for integrative health from Iowa, senator from Iowa, he put a small provision in that was set to rectify the wrongs for not just chiropractors, but for all of the licensed healthcare professions. And it said that in insurance, the private industry insurance, that if it was a covered service that was within your scope of practice, you should not be discriminated against in that insurance program. So you should also be able to provide that covered service. If your profession was included in that insurance policy and it was a covered service, that you should be able to provide that service and be reimbursed for it. So this became law. And 2706A has never been fully implemented at the state level in most states. And the federal government has a responsibility that has yet to implement. They've made an attempt to. It's been 10 years now, and they've made an attempt, but there's a rulemaking that's basically never been finalized. And so we have, and I will be happy to distribute a report that details all of the information, as well as a slideshow that provides the top points. But I think that as we're working on Medicare legislation, which is a legislative goal, but we also have the opportunity, because we have the best opportunity in government right now with a friendly voice at the White House and a friendly voice at HHS and across the administration to be able to move regulations and policies and procedures that advance and correct things that chiropractors have noticed. And 2706 is the top of that. And MAHA has taken this on as one of the things that we're going to focus on. So I don't want to go through all of the details except to say it affects chiropractors and it affects other professions as well. So when we right the wrong here, we're righting the wrong for all licensed healthcare providers. And for instance, if you have a nurse anesthetist and they're a part of an insurance policy, but they're not going to be reimbursed for providing the same services that a medical doctor who has that right to do, why is that okay? So the point of the federal government needs to to create an enforcement mechanism and then to have some teeth to it. Because if your insurance provider is discriminating and they don't comply with the law, but there's no punishment, there's no penalty, then it's an ineffective law. So we need to fully implement it, and it needs to be properly, there needs to be proper oversight and implementation. So that is one of the top policies that we can focus on with MAHA. But there are other things that we look at. Everywhere in healthcare, every policy table in healthcare should have a doctor of chiropractic at the table. Every healthcare policy conversation should also have a nurse at the table, and all the other healthcare professions who are providing services should be a part of the conversation. So here we're talking about chiropractic, but I look at it from the whole health, because that's where all of healthcare includes all of the licensed healthcare professions. So as we're fighting for ourselves in chiropractic, we're also fighting for everybody else in healthcare, and that's what this is all about. That's why MAHA is so important to this issue. So when we look at, for instance, we have military members who active duty who need chiropractic care. They get limited access to chiropractic care. It's not in every facility. We have a congressman who's a former naval officer, and he's like, I want a chiropractor on every Navy vessel. And why? Because you can recover from injury faster. If you get regular chiropractic care, you're less likely to be injured, and if you are injured, your recovery is going to be faster, and you're less likely to have to leave military service earlier, so that millions of dollars of investments that the United States government has invested into an active duty military member is not going to be ended early. In the military, the whole role of military health care is to keep you deployable. So that is one of the things that we have to work on, is making sure we're expanding access to chiropractic. But then the second part of that is the military family also needs to be able to have access. So active duty military families do not have access. So TRICARE is years late in modifying their rule to create that access. So we have opportunities through policies and regulations that we can change to increase those access. And this is where MAHA and the relationships that exist can make such a difference. The same thing in the Veterans Administration. Congressman Bost has a bill right now is to taking care of our veterans. And then part of that is the community health program, community care program. Chiropractors, yes, we have chiropractors in VAs, and there should be chiropractors in every VA facility, but most important for veterans is the community care providers, that they are close to them in their own hometown, so they're not having to drive 30 to 50 miles to go see somebody, so that they can get in when they need care, and that there's not arbitrary regional managers setting caps to visits on these issues. So I just want to stress that those are things that we can do, and I'm going to hand this off now to Bharon so that he can follow this up.
Thanks, Beth. I just want to talk a little bit more on strategy of the issue. One other thing that Beth didn't communicate that's a huge issue to us is chiropractors cannot serve in any branch of the military right now as a chiropractor. That was actually fixed in '93 and the NDAA allowing it, but it's never been enacted, similar to the issues with 2706. So we have chiropractors that are in service, but they have to have some other type of a career. They cannot serve as a chiropractor. So we've been working on this for about 6 years. And, we went into it talking about the typical chiropractic speak, that we help reduce the cost, that we have better outcomes, we can get people off of drugs, less surgeries, all of that. And the only thing that really resonated through all of our conversations that we had was helping them with, which is what Beth commented on, was helping to reduce the percentage of early separation due to non-combat related neuromusculoskeletal cases. When we had that conversation with them, we were able to elevate and say, we can actually prove to you, similar to what we do with athletes, similar to what we do with employees in business, if they have regular chiropractic care, we keep them performing at a higher level. We reduce the incidence of injury, and those that are injured will recover faster. And what better environment than our men and women in service to be able to produce that type of a reality. So as we kept moving that up, we had conversations with the alternative medicine committee within the DoD, primarily outfitted with PTs. We keep hitting that wall of the PT saying we already do mobilization manipulation. We don't need to add chiropractors. We kept hitting that wall. In Trump's first term, we were able to talk with him. We had an executive order that was going to be handed to him when he lost the election. He didn't do any executive orders. We've had 3 different languages submitted as an amendment to the NDAA. We wanted to prove this by putting chiropractors appropriately staffed in 2 U.S.-based facilities. Heidi Hoag and her team was going to track the data over an 18-month period to show a reduction in separation rate of people that are serving, that they're staying in service longer, they're performing at a higher level. We just couldn't ever get it across the line. So we're hoping with MAHA and the team and the ability to advocate to get above these lower level committees. Every legislator we met with loved it. They were all for it. They signed on and supported it. But we couldn't get the language in the NDAA, and we couldn't get higher up within the DoD to be able to have these conversations with the people that are going to say, this needs to happen, make it happen. So we have all the data, we have all the information. It fits perfectly with the MAHA movement. So we're really hoping that we're going to gain some ground here in the next 18 months at getting the DoD to take this seriously, to make it available to our active duty while they're in service. And as Beth said, also through TRICARE for the families to be able to have access to it on their end. So thank you.
Governor of Delaware, and I'll let her fill in more on that. And she also brought Dr. Rosenthal with her as well. So we wanted to give an opportunity to share, and I think you'll hear that Delaware was certainly progressive in dealing with chiropractic and supportive, and we're really happy to have you here. It's been a pleasure getting to know you through Lee and working together. So really excited for the update. Thank you.
Thank you. Wow, it's great to be here. Beth, following you, and also Bharon, following the federal initiatives. I have had the privilege of being in the front lines of chiropractors for over 3 decades as a state rep, state senator, lieutenant governor, and governor. And I have to say, it was a pleasure with Lee and the MAHA team over the past 1.5 years to dive into these conversations. Today, I know we only have like 5 minutes or less to speak, but I brought along somebody who's going to be here at lunchtime, because I anticipate after I have my conversation, you're going to want to talk to Dr. Scott Rosenthal, who represents one of the persons from the Delaware Chiropractic Society. Exactly what Beth and Bharon were saying. Federal initiatives, so critical. I think this afternoon's advocacy session before tomorrow is so important. The relationship that you're forming with Congress, also back in your state, really matters. Delaware, fortunately, yes, we're a small state, but in addition, we all care like you do why you're here. What is the purpose? Why did you fly here, travel here? You want the best for your patients, you want the best for the outcomes. In Delaware, going back for years, we have had a lot of the data, and hopefully Brandon will be able to share some of that with you. But Lee had mentioned to me to give a few examples. So I hope that you'll take some of these back to your states and build on this also in your congressional actions over tomorrow and over the next several months. In Delaware, we have had parity for quite some time when it comes to workers' comp. It's been over 3 decades. We have been able to never have a gatekeeper. We've never needed pre-authorization. And that came about because of conversations, relationships with legislators and evidence-based data. Last year, we passed what I think is one of the more critical pieces of legislation, House Bill 238, which we don't need you to have memorized, but the takeaway is parity. And what that bill did was have all commercial insurers and Medicaid and HMOs, they have to now not cap chiropractic visits or services, no cap whatsoever. And we have had for several years, actually I was a sponsor, I think a senator at that time, legislation that allowed for us to say you must pay all chiropractors the Medicare rate, and you also must make sure that clients do not have to pay more than 25% coinsurance. So we have been huge advocates. Why? Because they share data with us. They show the health outcomes, they show the measures, so that they're saving the state money. And I think as you go talk to members of Congress, you're going to emphasize to them, this is not an additional perk. This is for the betterment of your constituents, the persons who vote for you. This is for cost savings and quality of health. We actually also, I chaired the Behavioral Health Consortium for our state. And when I led the National Lieutenant Governors Association, have had a chance to work with most of your lieutenant governors, many of your governors now, and people do want the right outcomes for clients, as do the members of Congress. I was recently in Chicago. Senator, soon-to-be Senator Stratton out of Illinois, said to me, we have to do better at prevention, and particularly even in behavioral health. In Delaware, we mandate before a person even get prescription that chiropractors be on the front line of our help is here. So before you are prescribed opioids, have you really exhausted all providers, including looking at chiropractic services? Because we know 50 to 90% reduction. So I could go on for hours. And if you can't tell, I am a professor of nursing. So when Beth talked about the partnership, to get to full scope of practice, it is really important that you also align with other providers as you're talking to members of Congress, because you are a united front. And it is not just about the orthopedic surgeons, it's about also your provision of service. So as a, like I said, former elected official, I wanted to come. I've been pleased to work with Lee and Brandon and others with the MAHA team on areas where we can make an impact. So I'm going to stop there, but I hope over lunchtime, Dr. Scott Rosenthal, who said he didn't want to say anything now, maybe he does. I'll let him say hi. He said that he would be happy to come and hopefully come into the next meetings that you have in the future with a couple other colleagues to join you. But I really hope that you take advantage of the models we have in Delaware, and I know you can move the needle.
It's been really demonstrating the value of what we do, and that patients don't, if they're coerced or diverted away from a chiropractor, they don't just go sit on their couch. They go to another provider that usually escalates care, costs more money, is more invasive. So I'm definitely looking forward to meeting a lot of you over lunch and sharing some of what we've done in Delaware. I got my start in politics when I was probably 8 or 9. My father, chiropractor, filled 2 busloads of patients. We went down to the state capitol and he opened the state employee health plan to chiropractic in the 80s. And that was my introduction of passing out sandwiches to patients on a bus. And I kind of been involved ever since. So it's a true honor to be here.
Great. Okay, thank you all. Thank you. Thank you. And lots of data. It's really important for the insurers. They have a phenomenal relationship with the insurers, and it took some time, but that is the key, the outcomes.
Thank you so much for being here. We really appreciate it, and it's awesome seeing what you've been able to do in Delaware, and looking forward to learning more. Thank you so much. Next, we have Dr. Joel Bohemier. And he has been doing a lot of work in relation to looking at research, how to get that funded, has met with Dr. J. Bhattacharya, and is going to share a little bit about that work that he's doing. Thanks so much.
Awesome. Thank you. Thank you. Dr. Joel Bohemier, I practice in Naples, Florida. I'm also a second-generation chiropractor. My father was involved in chiropractic politics in Canada. I'm one of 46 chiropractors in my family, so I know it well. And last meeting, I was tasked with seeing if we could increase funding for chiropractic research. And so on April 10th, I met with Dr. J. Bhattacharya, head of NIH, in Bethesda in his office, just him and I. And you'll be happy to know that he actually has great experience with chiropractors. He's fond of chiropractic. He's used it himself with positive outcomes. And like he told me, he goes, but you guys aren't fringe anymore. Like he goes, maybe 30 or 40 years ago you guys were fringe, but you're not fringe anymore. And I pointed out that there's still institutional bias as it relates to chiropractic research dollars. If for those of you who don't know, NIH funds chiropractic through NCCIH, the National Center for Complementary and Integrative Health. That's 0.3% of the NIH budget, which is $54 billion. The NCCIH gets $170 million. Out of that, chiropractic gets zero. There's been 1 year where it got $7 million. So usually we get less than $1 million a year, or sometimes zero, right? And so I pointed out that there's definitely institutional bias. He claims that he fixed that in January, where he said any institution that applies, as long as they follow the rules, the NIH rules of application, should get funded. So he committed to me that he's going to follow up. We're going to follow up on 2 proposals to make sure that it gets funded, and if it doesn't, he wants to personally follow up to see why it didn't get funded. The other thing that he committed to me is a meeting with the new NCCIH director, who has not been appointed yet, although they know who that person is. Just Secretary Kennedy has not had the time to put his stamp of approval on the person yet. So when that happens, he also committed that within the description of NCCIH, that he would put in bold that there would be chiropractic research for whole body health as an example of what NCCIH does. That forces NCCIH to spend a significant portion of their dollars on chiropractic. And so, obviously I want to do this just to deepen my understanding of chiropractic, but I also feel like it helps the public, it helps chiropractors, and it helps also to strengthen our institutions who, haven't been, able to actually get the funding. So our chiropractic colleges, that would help them tremendously. So at the end of our meeting, he did have an ask for me. He did say that NCCIH was about to get axed. I don't know if you guys were aware of that, but the Trump administration had wanted to cut the $170 million. So he said, can you get the MAHA people together and kind of like save it? So I'm also co-founder of Stand for Health Freedom through MAHA Action here in MAHA Center. Overnight, we sent 10,000 emails to the committee deciding on NCCIH's future. And that was on a Wednesday night. They were supposed to vote on it on a Friday, and by Thursday they had decided to just keep it and not even vote on it, which is great. Now, I'm not claiming that it was us in this room who did all that, but I'm sure the 10,000 emails that went to that small committee member didn't hurt either. So, which is a good job to everybody here. Also, on that note, I just checked this morning, and Stand for Health Freedom had sent 8,165 emails to support the Medicare Modernization Act to the congressman as of this morning. We sent that out 2 days ago, which is great. So, I think positive things are happening. As soon as that new director gets appointed, I'll be able to meet with him. And my inclination and my ask to you guys is to say, if you know of anybody who's applying to NIH who for some reason does not get funded, please get it to me, and I will communicate that with Dr. Bhattacharya so that we can see how and why and how to get chiropractic funded. So thank you for your time. Appreciate it.
Thanks so much. Really important update. I think all of us in this room can speak to the results we've personally seen with chiropractic care, but it's critical that we have the data to back that up. And, I think that we're going to see some more research funding opportunities, and through MAHA, we're certainly hoping to encourage that, support that, and see how to make it happen. And that goes to the momentum I was talking about that we've seen over the last few weeks. We're getting lots of groups within the profession to mobilize quickly with MAHA and really make a difference. And speed matters in this moment in time. And I can't thank you enough for the work that you're doing and directly working with Dr. Bhattacharya. Next, we have Dr. Tony Ebel. You've seen him on the Media Hub a number of times. He has supported the work through committees that we have put together and, has a large focus with pediatric chiropractic through his offices. So he's going to share an update. Really excited to hear and appreciate all the support you've given so far.
Thank you, sir. I will do what we tell the kids to do in our practice, sit up tall. I don't have John's youthfulness or height, so hopefully you can see me over the MacBook here, a little vertically challenged. You know, every time God puts a movement together and he moves mountains, especially when it's focused on our kids' health and our families, he just puts powerful people together. So it's really a blessing to be in this room. I thank you each for the opportunity to make an impact here today. And I'll follow my notes here so I don't let my passion override my purpose. I think a lot of you know that our focus is on pediatric chiropractic and what we call the perfect storm, which is this early onslaught of stress to a child's nervous system that doesn't even start with toxins. It starts with the over-medicalization of pregnancy and fertility and perinatal care and then birth and brainstem injuries. And the truth is, a lot of you may not know where I got my start. So real quick, I graduated from Palmer. I am an Iowa farm boy originally. So wearing this suit coat and speaking is one thing. Wearing a suit coat is another for my nervous system to handle. But I started practice in 2007, and it was going to be an awesome general sports injury, family wellness. That was my start with chiropractic, and then God had a different plan. A lot of people know my son's story, but the contrast here, and that's where I want to go together with all of you with MAHA at Chiropractic. 2 weeks before I graduated, our oldest baby girl, Addison, was born. And that path was perfect. The pregnancy, we were well supported and empowered. Christina's nervous system, I stopped adjusting her and paid a professional to do it. And everything went with the most optimal outcome. And Addison's health just stood out in contrast to what we now know is the sickest generation of kids out there. So I shifted from injuries and traditional chiropractic, and I went all in on pediatrics. And I am a super nerd. So for 3 years, I got 3 different certifications in pediatric chiropractic, biomedical, this functional medicine, integrative care. We were doing it in my practice outside of Chicago before Instagram was even Instagram. And here's what we found, and it's carried forward to today. There's a ton of momentum, but there is millions of families still stuck in the mud, still spending their tires looking for hope, answers, and help. And 3 years into practice, when I thought I had a few things figured out, God gave me a clarifying moment where my son Oliver was born 6 weeks early with a very traumatic birth. And Oliver is a medical miracle because his diagnosis medically was severe HIE, so he had a ischemic brain injury. He had persistent pulmonary hypertension so bad that he needed heart-lung bypass called ECMO. And he spent 5.5 days on this machine in Lutheran General in Chicago. And I watched medical doctors who we need to work together save my son's life. But if you go on Google back then or AI now and you add up his injuries, his EEGs, and you put a prognosis together for Oliver, if you're being generous, what we call chiro math in this room, if you're being generous, he gets a 1% chance of having a fully healthy life. They told us he had a 20% chance only of living to age 1 and a 99% chance of severe disability after that. I need to get to the things we need to get done, but Oliver is 17 years old now and clocked a 4:45 mile this spring in track and is a state cross-country runner. So his pulmonary, his brain function, and is through the roof. So he's a medical miracle. But when medicine was done, for every other kid in that NICU, there was no chiropractor to pick up the baton. Just my son got adjusted 2 to 3 times a day. Just my son had his nutrition optimized. Just my son's parents had the faith, the confidence, and the conviction, Lee, that he could truly heal, and he did. So we truly need to work together because what parents are coming into our office now is they're coming in with chronically sick kids. They're not coming in for colic and ear infections and sports injuries. That's a blessing when we get them early. They're coming in with a level 3 autism diagnosis, pandas, epilepsy, and they're coming in with PDFs attached to their paperwork because our paperwork doesn't have enough blanks in it for them to say 2 things. All the different struggles their children have And here's the moment we can actually do something about today. And all the different doctors and specialists and providers that they have seen. They have not only exhausted the conventional medical system, but this is where chiropractors really need to unite and be at a place that these kids have long needed us to be. They have also gone down the list, and they have gone after root cause through the gut. They have gone after root cause through gluten-free, through immune system regulation, through detoxification, but not a single doctor. I took a case history, literally the last phone consult I took before flying out here. This child had seen 7 different natural holistic doctors, and no one had yet focused that mother's attention on the nervous system. That kiddo had a high-stress pregnancy. Mom was finishing up a master's degree and had a severe loss in her life. He had a severe emergency C-section with cord traction. And so the answers are there. What moms in this movement are looking for is not another modality. They're not looking to add another doctor or another intervention in the list. They're looking to finally have somebody go upstream into the nervous system and keep it simple, like these 2 rock stars are doing, and say good health starts with the nervous system. And the path to chronic illness actually starts with kids' nervous systems going into a state of sympathetic dominance, dysregulation, and what this room knows as subluxation. But the world doesn't yet. The moment that subluxation sets up shop in those early, sensitive, formative years of development, not just a few things go offline, not just the musculoskeletal system, which, by the way, motor development, chiropractic's wheelhouse, essential for brain development. The sensory motor sequence determines every other health, whole body, whole child outcome from there. Their gut's a mess because their nervous system shuts it down. Their immune system is both suppressed and hypersensitive because they're stuck in sympathetic dominance. So there's not a supplement, there's not a red light therapy, there's not a hyperbaric oxygen that this baby could take a nap in that is going to change that outcome for their nervous system. So I know that MAHA looks to support whole body, whole child health. That has to start with the nervous system. That subluxation, nervous system dysregulation, and vagus nerve damage from birth trauma, that is what parents are looking for, because it finally makes sense of 2 things, the 2 things they put on their paperwork. All the different struggles, all the different symptoms, all the different conditions and diagnoses and labels their child has. And it also makes sense of this second thing. And today, this has shifted in the last 3 years, thanks to MAHA and all the work that doctors and practitioners like us are doing. They want to know why everything they're doing isn't working. The uniqueness of chiropractic care is it doesn't solve everything. You make adjustments and the clouds don't always part and the angels sing. Often they do. And what it does is it sets every other form of intervention for success. Now digestion and nutrition and supplementation and detoxification and physical therapy, occupational therapy, social emotional therapy, teaching, instruction, and just life can attach to a strong foundation that is the nervous system. So we do a lot of good for these kiddos, but we set every other provider up to be so much more successful in what they do. That's what parents are looking for. So how MAHA can help this pediatric chiropractic movement is to legitimize that nervous system focused whole body approach, support public outreach and education, form alliances, and then Dr. Joel and this incredible crew are getting done what needs to be done. Get that research done. Show the data, like the governor said. We have the data in our offices, and I'll leave you with that. In our intensive program, kids come to our practice from all around the world, and this is in 2 weeks of care. 2 weeks of care, our stats are 83% improvement in sleep, 76% improvement in digestion, 73% improvement in emotional regulation, and 60% improvement in immune system strength. So I'll never probably stop practicing and podcasting to actually do research myself, but I will plug in with all of you guys and we'll take this work to the world. Thanks, guys.
Thanks so much. We've gotten to know each other well over the past number of months, and incredible work being done. And, I think you spoke to it well. We're an integral part of a care team, and, it's not to diminish any other type of provider. We just want to see these children get healthy. We want to make Americans healthy again, and, it takes a team. So thank you for the work that you're doing. We have 2 more speakers, and then we'll get to a little question and answer, and we'll break bread with lunch. I want to introduce Dr. Steve Kraus. We've glossed over this topic a bit throughout the day, but he's going to talk about insurance reimbursement and parity and doing some amazing work. So please take it away.
Thank you. I'd like to thank MAHA leadership for putting this together, and then the Chiropractic Hub leadership as well. I think this is a great way for us to get each state to advance their initiatives. And if we can follow what Delaware has done, I think we'll all be in a better place. I'm gonna go over what not to do first. So, as mentioned, I'm Dr. Steve Krause. I'm the chair of the Iowa Chiropractic Education Research Foundation. I'm also the past president immediate of the Iowa Chiropractic Society. I was also president back in 1995. So I think it's worth 1 minute of history here. Back in the 90s, we did not have the research. We didn't have the data to go bring to the legislature. We had a few studies, but we had a law passed in 1986 called the Iowa Insurance Equality Law, where we believed we should be paid equally as medical providers for same service. So what happened was we started discussions with insurance companies saying you're not paying us equally. It's just like Iran. Blue Cross Blue Shield kept promising this, promising that, and nothing ever happens. So in the end, we went to the legislature. They said, hey, we gave you the law in 1986. You're going to have to go fight it civilly. We've already given you the law. You've got the legislation. We go to the insurance commissioner. Insurance commissioner didn't want to agree with us. So in one of our 12th and 20th different discussions with the Blues, they finally said, and I was present for this in the late 90s, we're not going to change our reimbursement policy, sue us. So over the next 4 years, we raised $1 million from chiropractors. We entered into a 17-year lawsuit against the Blues in the state of Iowa, back and forth between district court. We went to the Iowa Supreme Court 3 times, and finally, here's what the Supreme Court said. You do have a law that says you're supposed to be covered for chiropractic services. So all third-party payers must cover chiropractic, but it doesn't exactly say you should be paid at an equal level. So then what we decided was, and this all just came to a conclusion in the last couple of years, so then we said, well, we have to go back to the legislature now. So we looked at Nevada's law. I wish we would have looked at Delaware's law, but we still will, okay? And what we decided to do through the Iowa Chiropractic Education Research Foundation was do studies to collect the data, because I interviewed 5 different legislators, and I said, what would it take for you to pass a new law? What data do you need? What information do you need to be convincing? And they said, the insurance companies are going to claim that premiums are going to go way up. That's going to be their claim. So we need data. So we initiated 2 research studies. One of the studies was 2 surveys, surveying all the doctors of chiropractic in the state of Iowa, asking them, how is patient care impacted by barriers, by lower coverage, by visit caps, by limitations in the coverage? Is it impacting your outcomes? Is it impacting your care plans? Are patients following through? Is it impacting your business? And then we took surveys of thousands of Iowa citizens and collected data to get their opinion on, is it impacting your choice of provider? Are you going elsewhere for healthcare services? Does it impact how many visits you go to the chiropractor because you're not getting full coverage for it? And the answers were overwhelmingly yes to this is a problem. And patients said it's a problem, doctors said it's a problem. So those surveys were just concluded in May. We had hired a research team. They are putting all this together to get published in a peer-reviewed journal. We expect it to get submitted in September. And then this January, we expect to come forward with a new law. We've already been drafting the language. We are hopeful that we have been able to plug the holes, because here's what's going to happen. Insurance companies are going to find loopholes. They're going to find ways to get around it. So using AI, we asked AI to find all the loopholes that we fed into it. And because of that, we now have a much more detailed law to prevent that. So we're hopeful that in January we are going to be able to get this law passed in the state of Iowa, and we think it can be a model for all the other states. But this Medicare Modernization Act is going to be critical for setting the stage, because one of the questions that these legislators ask is, what are the other states doing? So then the second study was on reimbursement. So thanks to Brad Cost and Infinity, they selected all the data for the state of Iowa and compared us to MDs, DOs, nurse practitioners, and physician assistants. And typically in the state of Iowa, PAs and ARNPs get paid 15% less than MDs. Well, chiropractors get paid 50% less than nurse practitioners and PAs, and almost 80% less than MDs. So the point is, data is going to help tell the story, and the legislators also asked us, what is Iowa like compared to states around us? So then we collected the data on the reimbursement from the clearinghouse for all the neighboring states around Iowa to show that DCs and other states are actually getting paid better than Iowa DCs when it came to x-rays and exams. And that's the real discriminatory section that we need to fight. So I just wanted to share with you that story so it can be a model, and that the legislative language that we've been able to craft we think is extremely strong. We did not know about Delaware, so we are going to be calling you to fuse that together. So thank you.
Thanks so much. Yeah, I think everyone in this room agrees we need to see parity, and we want you getting paid what you deserve for the work that's being done. So really appreciate all the research you've done on that and the support and effort towards it. Last but not least, I have Dr. Fab Mancini, who's going to speak for 5 minutes. I will say, it's been an honor having him mentor me over a period of time working through the MAHA team, and he has a resume that is multiple pages long, and has been a leader in this profession for a very long time, and somebody who I deeply respect and really appreciate, taking me under his wings. So take it away.
Thank you. Good morning, everyone. So I wanted to give just a little bit of a perspective how I got involved in this process. I remember when I received a phone call when MAHA was just beginning, and it was a phone call primarily to be able to help fundraise, to be able to get Bobby Kennedy in the White House. That was the introduction. I have met him a few times because of our speaking engagements. One of the things that I can tell you is the level of integrity, the level of conviction, and his record speaks for himself. But rarely have I met an individual that impressed me so much for so many years. So, of course, I took that call, and I made that a mission to be able to help in that process. When I saw the shift from the presidency into the Secretary of Health and Human Services, in my mind, I felt that that was a blessing in disguise. Because as president, I know he would have done a great job in this country, but I also know that the health of this nation is at a critical role, a critical place, that I was very concerned that it was getting worse and worse, and the statistics speak for themselves. So because of his track record, I knew that he has always served as an individual that has been able to create an awareness and also fight for the underdog, the individuals that don't have a voice for themselves. And he has been very successful in that process. And I don't know how many of you were able to join us at the MAHA Ball during the inauguration. I got to tell you that when I walked into that room and I saw the amount of people, it looked like a red carpet for the Academy Awards. The leaders of the healthcare profession were there, celebrities were there, but the most important thing is that everybody was believing in this movement called MAHA. MAHA didn't become just a fundraising arm. It was actually a voice, a megaphone for millions of Americans that were actually wanting to be heard, that they were not being heard by the parties to be. So from that moment on, I heard that his mission through the Secretary office was primarily to focus the attention on reversing chronic disease. Now, to me, being in the healthcare space, next year is going to be my 40th year in chiropractic. And I've been blessed to be part of most of the initiatives that have helped move the profession forward in that time. But I've never been a part of anything with this level of magnitude, because it wasn't just the secretary, it was also the White House and the president, all talking about disrupting the healthcare system like never before. We've seen it in other areas, but not in health. So that's what got me very excited. And then I came to the first meeting here in March. And that's when I had pretty much the pleasure to meet the team. When I heard that meeting being moderated by Lee, by Deidre, Kyle, and others, for the first time now, most of us have been serving this profession for years. Would you agree? And most of us have been in a lot of ineffective meetings in chiropractic. Would you agree? To the point that most of us will be like, why are we going to another meeting where we're not going to get the outcomes that we really need to get? That was the first time in almost 39 years that I have felt that we could actually do something different in chiropractic and be able to get the outcomes that we needed to get. And from that moment on, that's when I realized, I'll never forget, I got out of that meeting and one of my friends, Ken Greenwald, couldn't be there, and he wanted me to give him feedback immediately. And I said, Kent, this profession is about to grow like never before, and we have to be behind MAHA 100%. That was exactly what I said to him, and because I do believe that. And I know that right now, the Medicare is a very hot item, and it's a very exciting item, and to me, it was the most important item by all of us in the profession. But it's just the beginning. I want you to understand there's so much more to this picture, right? We have a vehicle in MAHA that has the ears of the White House, the ears of the Secretary of Health Department, and now all of a sudden the ears of millions of Americans that are supporting our paradigm. When I entered the chiropractic profession, it was a different shift. It was a paradigm shift. I was going to be a neurosurgeon, right? It changed my life. This is what millions of Americans, where disease lives, is in the people that do not subscribe to this paradigm of health and well-being that we promote. And that's why it's so important that to support this vehicle, now we have a megaphone that will allow us, not only in legislation, but in the education of millions of people that will recognize for the first time, in my opinion, the true value of chiropractic care. So what I'm doing for myself is to ask myself, and working with Brandon has been such a pleasure to see a young man with so much conviction, because many of our youth, right, look at our future leaders. Who do you see out there that you feel confident can carry in the next 50 years? And working with Brandon, I keep asking him, is there anything else that I can do to support MAHA, to support this chiropractic hub? That's the question that I want you guys to ask yourselves. And some of the things that I found out that I could do is, okay, I have the database of 40,000 chiropractors that we train. How can we get them engaged? Because many of our chiropractic family does not even know the inner workings of this group. And it's up to us to let them know. And then I said to myself, okay, I mentor about 300 CEO of healthcare companies. What can they do to support this chiropractic hub? Because their livelihood depends on the chiropractic profession growing and serving more people. And then I started saying, okay, I have hundreds of thousands of people following me through Fox News and Dr. Phil and others. What can I say to them in my segments to begin to bring light to some of the messaging and paradigm shift that we're trying to create here? So I urge you to please have a sense of urgency. I believe that right now we have a window like never before to allow more people to get under chiropractic care, and more importantly, to position the education and the value of chiropractic across all realms like never before. And it's up to us to drive that aspect. That's why we're here. But look, I know that MAHA may not have unlimited resources, and we're all trying to support them financially. But let me tell you what they do have. They are extremely resourceful. And it's far more to be resourceful than to have resources, I've learned in my life. But we have to support them, not only becoming more resourceful, but having more resources. So continue this process and understand that this really is a mission that is bigger than all of us put together. And for the first time, I can tell you, I have not been that excited about being a chiropractor until this happened, because I can see it, I can taste it. And Medicare is just going to be the first thing, but there's so many things coming our way, and we need to continue to support it. So God bless you, and thank you so much for being here.
Thank you so much. Perfect way to round out the day. You know, I'm hoping everyone here has seen what we're here to do. You know, Fab said it well. We are extremely resourceful, and you know, we do have a small team, but we're dedicated and we work hard. And it was the perfect lead-in to end this before Q&A and we break for lunch. You know, when the hub started, we asked this profession for something significant: trust. Trust that if you get behind us financially, we will actually stand up the hub, put real infrastructure behind chiropractic. And I believe the last 6 to 7 weeks have answered that. We are here to stay. And the work that you're hearing about all morning is what that trust has built. And, you know, since launch, the asks from the profession have come in really fast, and we welcome every single one of them. In public education, research support, putting our relationships across Washington and this movement to work for the profession. And I want to be clear, we hear you, and we want to do all of it in unison with the organizations and groups in the profession, not around them. But the reality is we are a nonprofit, and you know, the list is growing faster than the resources behind it. I'm extremely proud of what the profession raised going into this roundtable so far. But you know, the reality is the pace of support hasn't kept up with the pace of the asks, and our small team is working as diligently as possible to execute on all of these things. Certainly not a complaint, it's just the honest math. And, you know, I don't want this to be an ask without a plan behind it. So let me tell you what we've got put into motion so far. First, we built the tools. We have an email campaign ready that we can provide. It makes the case for each audience, whether it be practitioners, patients, you know, the vendors at the trade shows that we get to work with, their clients, et cetera. And when we get them rolling out in the coming weeks and one lands in your inbox, the single most valuable thing you can do is forward it to your own networks so that we can continue amplifying the message and the ask. And second, we're planning a dedicated fundraising committee built around people in this profession with a proven track record of giving and raising. So this isn't our staff team, you know, asking for help. It's going to be the profession funding its own future in an organized way. And we'll share more on that in the coming weeks. As a lot of you know, I wear multiple hats now, being in risk management for a long time with my dad and brother, which is an honor, and now as the executive director of the MAHA Chiropractic Hub. Our company is committed to giving $50,000 to this in the next week. And, you know, quite frankly, we're hoping to raise from the organizations in the profession another $250,000 broadly. And we see this as two tracks. You know, there are organizations that have the ability to fundraise in a more meaningful way, but we also want the grassroots track as well. And we're looking to raise an additional $50,000 from, you know, individual practitioners, patients, et cetera, to continue supporting that. And that really leads us to about $500,000 of total raise, giving us the runway to execute on the priorities that are being set in this room. I'm confident that we can get this done, and I'm hoping today, throughout, you know, all of the different presentations, we've demonstrated our commitment to this profession and have your buy-in to make this a long-term mission, see major wins, and it not be an effort that fizzles out because we can't get the profession behind us to support. So, I am honored to be in this role, to be able to get to work with this team, to be able to support the profession in a meaningful way. But at the end of the day, we also still need to be clear that we are a nonprofit, and it takes funding to be able to continue building on this work and see major wins for the profession. So I want to see if Lee has any further remarks, and then we'll get into question and answers and break bread together.
Let's get them and their patients, and let's go change America. We are here. If you guys can't do it working with us, believe me, just take something else up, because we have never been, we have Bobby Kennedy coming tonight as secretary of HHS. We have Dr. Oz. Joelle has a great connection with Bhattacharya. Like, we are here. We can do this. We just have to walk through it. And I see that people here in this room, we can do it. And then we'll bring in the kids. We'll make everyone healthy, and our parents and our grandparents. Well, I don't have grandparents alive, but I found today so inspiring. And thank you so much, Bethany, for coming, and the secretary. It's just, we are here. This is our moment. Thank you all. I'm glad that you took the time to come here. It must have been a big pain with the World Cup in New York, stopping all the flights. But I am leaving so energized. My husband's in the Hamptons. Like, I could be in the Hamptons. This is where we need to be. And I am here. I am committed. And Brandon, with you as our leader, I feel that there's no end to what we can accomplish. Thank you so much for being here. Thank you, everyone.